Time now 12:24. A new study is linking coronavirus reinfections to an increased likelihood of getting other serious health conditions. And it comes as COVID-19 cases and hospitalizations rise across the country. As Jen Sullivan tells us, a new wave of variants has some experts worried.
Getting COVID-19 two or more times could raise the risk of new serious health problems and even death. That's according to a new preprint study looking into the impact of repeated COVID-19 infections as a new wave of COVID variants are surfacing across the U.S.
The CDC still is reporting on the new variants, Omicron, and the subvariants like BA4 and BA5.
This study looked at the records of more than 5 million patients in the Veterans Affairs health system and found that people with 2 or more documented infections had more than twice the risk of dying compared to those with just one COVID-19 reinfection. Researchers say reinfection also increased the likelihood of getting lung and heart problems, diabetes, digestive and kidney disorders, as well as neurologic problems. This study found the risk was the highest around the time of a COVID-19 infection, but persisted for 6 months and increased with each additional reinfection. The new research comes as the U.S. sees a rise in COVID-19 cases and hospitalizations, with the 7-day average of new daily cases at 100,000, according to data from Johns Hopkins University. And as the virus continues to evolve, some health experts continue to recommend boosters and are calling for an update on what it means to be fully vaccinated against the virus.
In the context of a pandemic that is still ongoing and a virus that is continuing to evolve and creating more challenges, including reinfection, we might need to reconsider this. Up to date doesn't have the same kind of sense of completion.
For today's Health Minute, I'm Jen Sullivan.
Meantime, coronavirus was the leading cause of death for people between the ages of 45 to 54 last year, and it was the third leading cause of death overall in 2020 and 2021. Now, researchers looked at death certificates from the U.S. Centers for Disease Control and Prevention. They found cancer and heart disease were the top 2 causes of deaths overall.